Today, I want to get into how a inexpensive, generic medication that is really well tolerated can actually revolutionize treatment for autoimmune disease, including Hashimoto's, Graves' disease, ulcerative colitis, rheumatoid arthritis, as well as for cancer, weight loss, addictions, autism, infertility, and so much more. Hi, I'm your host, Dr. Izabella Wentz, the Thyroid Pharmacist, and this is the Thyroid Pharmacist Healing Conversations podcast. Today, I want to share a really special interview that I did a few years back with the late Dr. Mark Mandel, who is a brilliant pharmacist, visionary healer, and a true pioneer in the world of integrative medicine and compounding pharmacy. Dr. Mandel was the founder of Mark Drugs in Roselle, Illinois, one of the first accredited compounding pharmacies in the state, and he was a tireless advocate for utilizing pharmaceutical treatments that really work. He dedicated his life to helping patients with complex chronic health conditions through customized therapies that went way beyond conventional care. One of the most helpful tools in his pharmacy toolkit was low-dose Naltrexone, affectionately called LDN. And I really want to share this interview that I did with him for The Thyroid Secret. This interview has never been published in its entirety. Before Dr. Mandel passed, we had talked about actually turning this into its own documentary series just because this medication is so incredibly powerful. We get into all of the different ways that it could be utilized, the conditions that it can help, as well as some of the best practices. I hope this interview will be life-changing on your healing journey. And I did want to mention that I am going to be releasing the entire Thyroid Secret again for free. If you wanted to sign up, you can go to thyroidpharmacist.com/TTS. It's only going to be streamed free for about a weekend, so make sure that you do sign up for that.
My name is Dr. Mark Mandel. I'm a compounding pharmacist. I'm a PharmD.
What's a nice pharmacist like you doing in integrative medicine?
You know, it's like so many other people in integrative medicine. I think you end up there because you're dissatisfied with traditional allopathic medicine. You're looking to be able to do more for your patients. You can only get so far when you're treating chronic disease with allopathic medicine. We had patients who were chronically ill, had patients who were not getting better, and I said there had to be a better way. And compounding and integrative medicine sort of led me in that path.
Can you talk about some of the things that you're able to do with compounding medicine that you can't do with dispensing traditional medicine?
Wow, there's so much, and we only have, 15 or 20 hours to do this. Compounding medicine gives you options. It's able to let you get outside of the box. Instead of just taking one path, it gives you a lot of different paths because we're all different people. We all have different needs. Anything from bioidentical hormones to thyroid disorders to if a person has chemical sensitivities or have environmental sensitivities or sensitive or allergies to additives, preservatives, dyes, fillers, whatever the case may be, compounding pharmacy allows you to make those steps to step, again, outside of the box, outside of that normal limitation. And you can have tremendously positive effects on your patients.
Now, one of the areas of your expertise is a medication, and this is kind of one of the best kept secrets. Medication known as Naltrexone, and it can help modulate the immune system and help people with autoimmune disease. Can you tell us more about how that works?
Naltrexone is one of those incredibly amazing chemicals. In a traditional allopathic sense, Naltrexone is used for alcohol and drug addiction. The reason it's so effective, or I shouldn't say so effective, the reason it's used so often is because it's an opiate receptor blocker. Opiates are things like morphine, heroin, tramadol, hydrocodone or Vicodin, very commonly used or commonly known products that are available. Naltrexone goes in and blocks where those drugs work in the human body. So they block that pleasure receptor if used on a chronic, on a preventative basis. Naltrexone is typically used anywhere from 50 to 200 milligrams on a daily basis. It has to be taken every day for the drug addiction or alcohol addiction. When it's used in a very, very low, very, very minute dose, And we're talking minute, we're talking about 1/10 to 1/40th the normal oral dose for how it's used traditionally. Naltrexone partially blocks the receptors, those parts where those chemicals work in the brain. And it has an interesting effect. Partial blockade allows the body to actually increase the own endorphin production, the own body's ability, that's endorphin, the morphines or morphine-like substance that the body makes. So by increasing the production of those endorphins, and then also by increasing the number of receptors and the sensitivity of those receptors, it seems to have an immunomodulatory effect. So it's really incredible because we see over 200 different conditions that low-dose naltrexone can have a beneficial effect on. And these range from Hashimoto's thyroiditis, Graves' disease, multiple sclerosis, lupus, asthma, simple colds and flu, things as diverse as herpes and shingles, where it can cause those conditions to normalize or to clear up temporarily. I've had patients with shingles attacks that when they use low-dose naltrexone, within 3 to 5 days, if they were chronically having these shingles attacks, they disappear. Wow. Absolutely amazing types of results. We've had patients who have had multiple sclerosis, and where they're in chronic progressive or even remitting relapsing multiple sclerosis, where they are able to use low-dose naltrexone and their symptoms just slowly start to dissipate. And they're able to resume a normal lifestyle and resume, being able to do things as simple as writing their name or eating with a fork and knife or being able to drink from a coffee cup. It's incredible the differences in people's lives that the low-dose naltrexone has had.
Is it true that some people who had multiple sclerosis and were in wheelchairs were able to come out of their wheelchairs with using low-dose naltrexone?
We've seen it in our practice, yes. And as I've had colleagues around the country and around the nation, around the world, who've told me the same types of things. I've worked with people in Toronto, in Scotland, in Ireland, as well as in the United States. And we all have very diverse practices. But the one similarity, the one commonality, is that using low-dose naltrexone, we've all seen changes in our patients that are miraculous, beyond the description of miraculous, where, as you said, a patient who's in a wheelchair is able to walk with a cane. A patient who's walking with a cane is able to walk without it. A patient who is unable to write their name legibly or be able to write a check is able to write a letter to a loved one. So it makes life-changing changes. Is that a good way to describe it?
That's a great way to describe it.
It's a redundant word, but that's what it does. It just blows you away.
We know for autoimmune disease, a lot of times disease-modifying drugs are going to be recommended or immune suppressants by rheumatologists. Is low-dose naltrexone like that? Does it work the same way?
Sort of a loaded question. I don't think any immune modulating drug works the same way. The monoclonal antibodies, which are the new hot drug, which have been out in the last 10, 15 years, all have slightly different mechanisms. To the best of my knowledge, low-dose naltrexone works from a completely different approach from those medications. Most of them will suppress the immune system, will suppress some action of the immune system. So if something is attacking the body, they'll basically put up a wall, a barrier. Low-dose naltrexone tends to, instead of putting up a barrier, tends to bring the body's immune system back into line so it functions appropriately. So instead of trying to walk that tightrope of working, not working, of being able to attack, being able as opposed to being suppressed, low-dose naltrexone seems to bring it back into line and seems to retrain the body in a new way. So it's an interesting aspect in my thought, is that low-dose naltrexone will teach the body how to work properly over a long period of time so that it keeps it on that straight and narrow, as opposed to most of the other drugs that are out there, which are used for autoimmune conditions, tend to suppress it and hold it down and don't teach it anything new. So they're more reactive as opposed to proactive, if that's a good way to describe it.
I think that's a really great way to describe it. Another thing that I wanted to talk about was the side effect profile of low-dose naltrexone. Can you give us a little bit more information on that?
Low-dose naltrexone is really unique. The only drug interaction directly would be narcotic analgesics. And as I said, that would be morphine, hydrocodone, tramadol.
Like Vicodin, right?
Vicodin, exactly. So most of those things, if you separate them, unless of course they're sustained release products, if you separate them by an hour to 3 hours, you're not going to run into a direct drug interaction. Now, there are other conditions or other situations that we have to take into consideration in any disease state, but they're not actually direct drug interactions. In general, there's really no drugs that it can't be used with other than directly, immediately with those narcotic analgesics.
The other things to consider with the disease-modifying drugs and the immune suppressants is they can't be used with every kind of medication. So they actually suppress your immune system, and you're at risk for getting other types of illnesses. So you're more susceptible to the flu virus. You're more susceptible to things in our environment. There are higher rates of cancers with those kind of medications. What about low-dose naltrexone? People are probably listening and they're like, okay, well, if this drug works on the immune system, then it probably has really severe side effects.
You know, a lot of people, when you talk about the immune system, you're talking about, and when you talk about drugs that affect the immune system, you think that they're going to suppress it. Low-dose naltrexone modifies the immune system, so it makes it work correctly. Mm-hmm. So some of the things that we don't see with low-dose naltrexone is we don't see an increased risk of cancer. In fact, it's something that's used quite often to treat cancer. There's a physician in Toronto who's done wonderful work with low-dose naltrexone and cancer treatments. In fact, Dr. Angus Dalgleish recently had published a paper on the mechanism of action of low-dose naltrexone and cancer. So a very interesting paper. There's been other physicians over the last couple of years who've also published wonderful papers on that very topic. I had a colleague once said to me that they use low-dose naltrexone when they enter into the flu season.
Really?
The cold and flu, right. And I had to really think about that. I said, is that something we want to use as a preventive medication? And I was a little on the fence with that approach. And yeah, I still haven't completely made up my mind yet. I don't see any reason not to in general. It's just like using high-dose vitamin D3 as a immunomodulatory type of product. I think it has an appropriate place. But I really like the way low-dose naltrexone seems to modulate and teach the immune system to work appropriately. I don't care for most of the other immunoinhibitory products because, once again, they're doing something that's not natural. They're holding you down. They're not letting the body do what the Lord intended it to do. Mm-hmm. And that's one of the reasons I think that we see such a great variety of benefits from low-dose naltrexone in so many different conditions. Mm-hmm. And it's almost, when we look at something that is giving benefit in a number of different conditions, sometimes you refer to it as shotgun therapy. And I don't really see low-dose naltrexone as that. I see it as something that works on modulating, teaching, and adapting the immune system. The side effect profile of low-dose naltrexone tends to be very limited. The biggest thing that we see is at the very start of its use. Quite often you will see vivid dreams. They may be nightmares, they may be night terrors at the very bad end. On the other hand, they may be a feeling of elation, as if you're flying. Some patients say that they have erotic dreams. It all varies from patient to patient, but tends to be very limited. If those dreams are disturbing, or if they disturb your sleep process, then you can either lower the dose, which I don't usually recommend, or better still, to take it in the morning instead in the evening. The typical approach to giving low-dose naltrexone, at least starting dose, is to use that dosing in the evening, in the PM. And that comes from the research done back in the 1970s from Dr. Bahari. And he found the greatest benefits to using it at nighttime. But morning dosing is perfectly all right. There's a lot of clinicians that automatically use it in the morning, especially if they have a notion that the patient may have some sleep disturbances. And certain medical conditions do have sleep disturbances, and so it makes sense to use it that way. The only drug interaction directly, of course, is opiate and painkillers. And that would be the hydrocodone or Vicodin, morphine, tramadol. And normally you can just separate this by an hour to 3 hours from the dosing of those drugs. Since you're only giving low-dose naltrexone once a day, it tends not to be a great challenge for most patients and most clinicians. Other medications that have much more severe profiles as far as side effects would be something that you think of relatively innocuously, and that's the steroids, prednisone. Prednisone suppresses the immune system, it holds it down. But it causes dysfunction with electrolytes, it causes dysfunction with gastrointestinal issues, it causes increased gastrointestinal inflammation. The interesting aspect of that is that prednisone is considered an anti-inflammatory. But when you use it and it causes intestinal inflammation, and the intestine is actually responsible for modulating anywhere from 70 to 75% of all inflammation in the entire body, as well as the immune system itself, it's almost counterintuitive to use a product like prednisone for an autoimmune condition because you're trying to suppress the immune system with that, which again, compared to low-dose naltrexone, which modulates that immune system and makes it work appropriately, the prednisone, which is designed to decrease inflammation, actually causes an increase in inflammation. So it's a vicious cycle. And so many clinicians are locked into that, immediate gratification of the prednisone of the steroid inhibiting the immune system and inhibiting inflammation, that they don't really look at the big picture. They don't get the big picture. And that's one of the things I love about low-dose naltrexone is that it really does work on the big picture. One of the things that we've found with some patients with certain conditions, such as thyroid disorders, Hashimoto's, is that when you give a patient low-dose naltrexone, the traditional dose of starting with 1.5 milligram and gradually progressing up to 4.5 milligrams on a daily basis, that might be too much for that patient group. With Hashimoto's, sometimes we have to start the dose of low-dose naltrexone almost in a pediatric dose. So we'll start it at 0.5 milligrams or 0.1 milligram.
Wow.
And it's very easy to do that with low-dose naltrexone because we can put it into a liquid, we can put it into water, and it's very stable. So we can gradually adjust that dose, whether raise it or lower it based on the patient's response using a liquid. And again, very simple, very inexpensive. This medication is so cheap. It's so easy for patients to use. It's so easy for physicians to order. And it's so accessible if you have a good compounding pharmacist who knows how to make it.
Mm-hmm. Are there challenges with making it as a compounding pharmacist? Do you recommend people make it like on their own, or do you recommend that they go work with a compounding pharmacist?
I think that it's very foolish for a patient to make a medication on their own. By definition, a medication, irrespective of whether it's low dose or full dose, is going to have a change on the body. And when something has a change on the body, you really want to be directed by a professional. You want to be directed by someone who knows what they're doing, who knows what to expect, and knows how to answer your questions. If you take a medication, I don't care how benign it may be or it may seem, and it has an untoward effect on the body, then you're having a very negative impact on the body. And it may take a very long time. If a person is otherwise compromised, it may take a very, very long time for them to recover, to recuperate. And if a patient has a chronic condition, if they have Hashimoto syndrome, the thyroiditis, it can be very devastating to them. They have multiple sclerosis. It's a devastating condition. And if they take the wrong dose, or inadvertently the wrong dose, if their calculations are off, if they've made an error, it's not good. Because whereas something may be able to benefit them if used appropriately, relatively quickly, if it's given the wrong way and it hurts them, it can take a very, very long time to recover. So I never recommend that someone do that on their own. I always recommend going to a healthcare professional, working with a physician who actually knows you and who knows about knowledgeable and is going to do it the right way, who has all the appropriate training, all the appropriate condition, and it has, has all the appropriate training, has all the appropriate equipment, and knows what they're doing.
I've seen some patients who said they failed LDN, and what I came to find out they did is they just got a prescription from their doctor for the regular strength and then try to make it themselves at home.
Yes, that's not uncommon. People with chronic conditions are often financially challenged at that point in their lives. Coming to someone like myself, going to an integrative medicine physician is rarely the first stop on their journey. Quite often they're financially challenged because they've gone through so many different situations. Because their disease has debilitated them, they no longer have the full earning income. They may have lost their insurance, or they no longer have good insurance, will pay for the products that they need. There is a wonderful story, a very tragic story, about a patient that was in a Julia Chopik's book, Honest Medicine, Malcolm West. And Malcolm had a fantastic job with fantastic insurance, a brilliant gentleman, and he has multiple sclerosis. And Malcolm would use only traditional medicine, what his doctors gave him, what his doctors authorized, because he had great insurance and he bought into the allopathic system. But it wasn't until he had lost a lot of his insurance ability to pay and has lost his ability to function that he said, I'm going to try this as a last resort as low-dose naltrexone. And Malcolm went to low-dose naltrexone, and it changed his life.
Wow.
So unfortunately, here we have someone who was absolutely brilliant and trusted the allopathic traditional medicine and was failed by the system. and it was low-dose naltrexone that had an impact on his life. And the reason I'm using his name is because he has given authorization to use it in a previously published book.
How does it make you feel to know that there are people out there who are really struggling with their health and they're trusting their doctors, they're trusting their allopathic doctors, and they're put on these heavy-duty medications that are suppressing their immune system and potentially making them sicker when there's an option like LDN?
It makes me feel very conflicted. Number one, I'm very sad that people have to go through that. I'm very sad that they are limited on the treatment they can get. It makes me, on the other hand, very elated when I'm able to help them. When a patient comes to me after having gone through the allopathic guidelines, after having gone through that portion of their journey towards health and their desire to get well, and they come to me as a last resort, and I'm able to help them, I'm able to direct them to a clinician, I'm able to direct them to someone who can guide them, who can actually give them long-term benefits and change their lives, I feel elated. I feel I've done something good. I've done something that the Lord has put me on this earth to do, and that's to work with other people. My daughter, Rebecca, is a massage therapist, and she is an incredible clinician. She's a healer. And just this morning I was talking to her, and she said that she was in a group and they were talking about themselves and where do I come from, and women being enabled and women being powered by those before them, and that it's not just the individual. And she made me cry because she said, I come from a dad who's a healer. I come from a great-grandfather who was a physician and a healer, and that's what I want to be, and that's what I am. I'm a healer. And low-dose naltrexone and integrative medicine enables me to heal people. And you can't use the word cure, because there is no cure, but to improve the quality of life, to improve the overall situation, to give someone a chance, a fighting chance to be stronger, to be better, to move forward, to, once again, enable them towards a better life. That's a gift. That's something that the Lord gives you and that you have to try to pay it forward. And the beautiful thing about low-dose naltrexone is it's so affordable. The typical patient is going to spend less than $25 a month for their treatment. Some of them spend as little as $6 or $8 a month for their treatment, compared to the tens of thousands of dollars that they have to spend annually on their traditional allopathic medications. This is a huge difference in the paradigm of treating autoimmune conditions. So having this ability to treat a patient, having this ability to give them an option is huge. It's fantastic. It's life-changing, not just for the patient, but also for the clinician. And one of the beautiful things about this is that when we talk to patients who say, how do I get my doctor to write for this? The first thing we do is we say, we need to teach you how to talk to your doctor. We need to teach you how to instruct your physician, how to communicate appropriately. And there's a wonderful book that's out called the LDN book that was written by a collection of physicians, of clinicians around the world who all came together for no pay. And each one wrote a chapter in order to empower patients to speak with their physicians, empower patients to give their physicians the knowledge to treat their various conditions. So anything from, which I've said before, Hashimoto's thyroiditis or Graves' disease, mental health, alcoholism. Many of these conditions are addressed in this book. It's called the LDN book. And I'll pick it up. The LDN book. And the woman who compiled all these clinicians, who twisted their arms, was Linda Elsegood. And Linda is a absolutely lovely, lovely woman who lives in Norwich, England, and is an inspiration. And every year or every other year, she works to put together a conference internationally. And I've been very blessed to be her Master of Ceremonies since 2013. And it's one of those joys of mine to be able to give back. But all the authors who've written chapters in this book, none of us took any money. Linda came to each of us and said, I want you to write a chapter on your specialty. I want you to write a chapter to help others. And we said, okay. And how long do we have to do this? And she said, you have 2 months.
Wow.
Yes.
That's
so
intense.
This book was compiled by over a dozen authors contributing in less than 60 days. And every chapter is better than the next. It's wonderful. absolutely wonderful. I highly encourage anyone who wants to learn about low-dose naltrexone or learn more about low-dose naltrexone to obtain this book. It's called the LDN book.
You know, and I'm so grateful for the work that you're doing in the world and for spreading this awareness. I know I first learned about your work a few years back, maybe 2012, 2013, and you were hosting an LDN conference and you were spreading awareness and letting people know that this was something that can really dramatically change people's lives. And you were even speaking to the colleges of pharmacy because, like you said, a lot of us, we go into this to help people. And then you get to work, you get into the real world, and you see the same patients month after month, and they're not getting better. They're getting sicker and sicker. And now with the work that you're doing, you're actually able to see the reverse.
It's a blessing. It really is. I mean, I feel very privileged to have this opportunity. I feel humbled when you say something like that, because all I'm doing is taking the work of other people and using it. I'm enabling people. I'm in a good way. You know, when you have the opportunity to make a difference, when you have the opportunity to use something that you've learned and to improve the overall condition of your patients and the quality of life, I think you're cheating yourself if you don't take advantage of it. One of the things we've done in compounding pharmacy is it's not just a business. We bring students in, we have students in from about 12 different schools from around the country who learn how to compound. And one of the didactic aspects of each of those rotations in their fourth year, in their P4s, fourth year of pharmacy school, is that we teach them about low-dose naltrexone. And it's not that they're learning so much directly about low-dose naltrexone, is I'm trying to open their eyes that there are other approaches. Because when a patient comes in and talks to you about an herbal product, or talks to you about light therapy, about full spectrum light therapy, or talks to you about vitamin D3, or talks to you about low-dose naltrexone, if you've never heard of it before, you might be put off a little bit. Mm-hmm. But if you have the idea to start with that nothing is potentially foreign, that there are other options out there, that there are other treatments, that nothing is without premise, well, all of a sudden then that makes you a much more complete practitioner. And that allows you to help more patients. Again, it's paying it forward. And that's what we try to do. That's what compounding pharmacy has allowed me to do. And that's why I work with so many pharmacy students. That's why I work with so many pharmacy schools. And I try to engage them. And I certainly can't enlighten them. That's not within my power. But at least I can try to open up their mind to other alternatives and other options. So that if someone else comes to them at some point in their life, sometime in their career, they're able to stop and think and listen and maybe help someone else just a little bit more than they could before. And I think that should be the goal of all clinicians, of all practitioners of health.
Mm-hmm. Thank you for doing that and opening up and sharing your wisdom and sharing your expertise with our future. Why do you think this stuff is not taught in medical schools and pharmacy schools?
Oh, why do I think this stuff is not taught in medical and pharmacy schools? In Western culture, we have an orientation of trying to be reactive, of trying to fix something immediately. And it's very, very challenging to try to go to the root cause. It's very challenging to try to find out what the origin or the etiology of a problem is. And in Western medicine, especially in the United States, we are challenged by a lack of time, we are challenged by a lack of funding, we are challenged by a lack of practitioners, and unfortunately, a lack of knowledge. We are very, very skilled at responding, at reacting. And one of the ways that we respond and react is through medication. And the unfortunate aspect of this is that medication is driven by big pharma. And it's not a wicked, terrible entity, but it's a fact.
It's a business.
It's a business, that's correct. And as much as we hate to see it, and as much as we hate to say it, medicine is a business. I couldn't have my pharmacy and I couldn't take care of people unless I made a profit. That doesn't mean a profit is a dirty word, but I couldn't employ my staff, I couldn't pay my rent, I couldn't feed my family, I couldn't put my children through college unless I had an income. And so I sell product. Big pharma and drug manufacturers are the same way. They sell product. Western medicine is financed largely by big pharma, at least the idea of big pharma. In schools, we're going through medical schools, we're going through pharmacy school, we're taught about how to use drugs. We're taught how to diagnose, we're taught how to use projections for a prognosis, we're taught how to treat, and the treatment modalities that are most common are surgery and drugs. And unfortunately, unless someone can pay for those drugs, they cannot be used. So in our medical schools, because there's only a limited amount of time to learn everything you need to learn before you go out and practice, in our medical schools, physicians are taught about medications, about drugs, and they're taught about drugs that are being available in the mainstream. And that's what's put out by large drug manufacturers or generic manufacturers for those who have already gotten past their patent dates. So when we come to an alternative approach, there's no monetary conduit to bring it to the practitioner, to train or teach the practitioner. So many times that gets lost. It's not unless the practitioner goes out on their own, either due to some family member having experienced something or their own personal anguish or their own personal challenge. It's not until they've gotten some opportunity to learn outside the traditional treatment or traditional training area that they learn about these products and that they become knowledgeable. I've found so many practitioners over the years, myself included, who have learned about alternative and integrative medicine, not because it was something they always dreamed about doing. I mean, you don't dream of becoming an alternative doctor. You don't dream of growing up and becoming an alternative compounding pharmacist. There's something in your life that changes that. Either you find something you like about that aspect of the profession, or there's some challenge that you've encountered personally or with a family member or someone you love or someone who's close to you that has not been successful in having their challenges and their needs met. And so in my case, I had a personal challenge, and a pharmacist taught me that there were alternatives to the traditional allopathic approach to treating my problem. And that pharmacist changed my life, and I'll be forever grateful to him. I'm very sad and embarrassed to say I don't even know his name, because he had such a great impact on my life, and he paid it forward. But he taught me that there were other treatments besides drugs, besides medications, besides prescriptions that could treat my condition. And I've talked to so many other doctors over the years, so many other integrative medicine clinicians who have been driven by that same motivation, where they had someone who was dear to them, or they themselves were very ill, and their needs were not being met by the traditional allopathic community. And they went into integrative medicine. They went into compounding. They went into using low-dose naltrexone or trying to discover ways of enriching their practice. Doctors such as Jill Cottrell, who is an incredible integrative medicine physician, has written in the low-dose naltrexone book, the LDM book, that she was a traditional physician who was not able to treat her patients. They weren't getting better. They stayed sick, or they were getting sicker, and she was doing everything she could to make them better, and she was failing. And she felt a failure in her heart, and she said there has to be a better way. And then a patient came to her describing LDN. And at first she said, "What can that be? I don't know anything about that." And she learned about it and said, "I can make a difference." And ultimately she became a proponent of the product, and it changed her life. It changed that life of her patients. It changed her practice, and it gave her renewed strength and a renewed vision for what she wanted to do with her life professionally. And so many other patients have experienced this, and so many other clinicians have experienced this with their patients or with themselves or with their family members. And it's just incredible. It's absolutely amazing the changes that will occur when you have another tool to use. You know, if everything looks like a nail and only because you only have a hammer to work with, well, then again, you have only a hammer and everything looks like a nail. But when you have a whole toolbox, there's so much more you can do. And that's what LDN and other integrative approaches has allowed us to do. It's given us a whole array of tools to use. Because this is not the only one. This is not the only one. It's only the beginning. And as you learn about one, you start learning about others. And as soon as your mind is opened, as soon as your approach is open to look at things with an open mind, it's amazing how beautiful the world becomes, because we have so much more things that we can do that are so much more gratifying and beneficial to our patients. And that's why I love doing what I do, because I have those opportunities. I have those tools to work with. I've got not just one hammer. So it's amazing how the world changes in your perspective when you're just seeing it so differently.
That's just so beautiful. And it's amazing to hear that you were first brought to this by your own health journey and your own health challenges. At any point when you got sick, did you feel like it was like, why is this happening to me? Why am I going through this? Because were you already a pharmacy student? Were you already a pharmacist at that time?
No, actually, it's one of the things that drove me towards pharmacy. I had this change in my life made where I was chronically in pain, where I was, wasn't able to focus and study, where my grades were failing, where I was not able to perform in a way that I performed my entire life. And this pharmacist recognized it and started asking me the questions that I was afraid or not smart enough, not cognizant enough to ask myself. And when he asked me those questions, and then I was able to answer those questions myself and then be guided by him, that's what changed my life, and that's what drove me towards pharmacy. And that's when I say, you know what, I want to be a pharmacist. It was never on my periscope. It was never in my view that pharmacy was a place to go. I was planning on traditional medicine, that I wanted to work with children, I wanted to work with adults, I wanted to work with geriatrics, because I wanted to help people. But so that continuity, that wanting to help people, with like an aha moment meeting this pharmacist, and it gave me a new venue, a new way to do it. It's funny, when I went to my advisor in undergrad, and I said, doctor, I no longer want to go into medicine, I want to go into pharmacy. He looked at me and he said, why would you want to go into pharmacy? That's such a boring profession. And I stopped and thought, this is a man who I really admire, who's absolutely brilliant, who is an incredible teacher. And I thought to myself, why would you go into teaching if you're going to dissuade someone from following in something that they've decided what to do? And that especially since my motivation was to help people. And that's what I said to him. I said, I think there's a way for me to really help people, and I think that I will grow and I will be happy if I'm doing that in my life. And that's what moved me towards pharmacy. And going through pharmacy school, I learned everything that all of us pharmacists learn. I learned about drugs, I learned about mechanisms of action. I learned about, actually in those days we didn't know too much about receptors, but I learned what they were teaching us in pharmacy school. And as I moved forward, I was fortunate enough to work in an independent pharmacy. And that independent pharmacy allowed me the opportunity to actually talk to patients. That independent pharmacy allowed me to actually have the opportunity to make compounds. Well, when you're making compounds, immediately it takes you out of the box, because you're not just using that limited group of medications that are available on your shelf. You're modifying something in order to meet challenges. You're modifying something in order to solve problems. And that's what led me into the integrative mode and looking at other alternatives. And I have to thank my preceptor and my mentor, Howard Dubman, who was my first employer in pharmacy, who gave me that opportunity. And I still see Howard, and I am very grateful, almost 40 years later, that he did give me the opportunity, because it changed my life and the lives of so many other people as well. My daughter, for one.
Yeah, that's an amazing story of your daughter, how she is identifying as being part of the healing community and feels like that's within her. And really, that's all of us, that's what we all want that are in any health profession, is we just want to help people. And it can be very frustrating and very challenging for us to not be able to help people when they just come in and they keep struggling and they keep, like getting worse and worse. You now have been able to help thousands of people within your career. How does that make you feel to really reflect on that?
I'm very humbled. I couldn't do it without compounding, that's for sure. Certainly when I worked for the chain pharmacies, at the very start of my career, I was limited to those products that were being dispensed from the traditional manufacturers. And I did talk to my patients. I asked them questions, and I answered questions for them when they asked me. But it wasn't as satisfying as being able to move forward and owning my own independent pharmacy to give patients additional options, to not be constrained or restrained by what I had to do in that business model where I worked at the chain pharmacy. We now have had tens of thousands of patients, possibly even hundreds of thousands. I don't know the actual number. I've been doing this now for over 30 years in compounding pharmacy, and so yes, it may be over 100,000 patients. I don't know. I know that we have on low-dose naltrexone between 8,000 and 10,000 active patients currently on low-dose naltrexone. So as well as other treatments that they're not on. So yeah, I guess it's completely possible that we may have that many, but it humbles me. It humbles me to have had this opportunity. It makes me very, very happy. It makes me very sad also. So I feel very conflicted because it means that there's so many more patients who are out there who are not able to benefit. You can only help someone, you can only benefit someone who's interested in being helped, who's being benefited by it. I have a very, very dear friend who's an integrative medicine physician, and one of the questions he asks his patients is, how much of your health is my responsibility as your doctor? And then he asks them, well, how much of your health is your responsibility as the patient? And it's always very interesting because in the vast majority of cases, the patient who's at least naive to integrative medicine will say a very, very high percentage of the responsibility is the doctor, is the clinician, and a very, very low responsibility is the patient. And it doesn't make much sense because the doctor is seeing you maybe 0.1% of your life in order to guide you, and you've got the other 99.99% of your life that you're with you that the doctor is not. And so those numbers really should be more even or even reversed, that let the clinician guide you as a patient. But you have to be on board. You have to be able to take responsibility for yourself. And you have to be able to move yourself forward. And unless you don't have that intellectual capacity, which certainly there are not many people who don't, you should have that intellectual interest in guiding yourself. So I feel very blessed to be able to communicate with people, be able to ask them questions, be able to listen to what they're asking me, and find out what they really need and what they really want. But I don't ever try to press myself on them. I'm not trying to proselytize any patients to follow an integrative approach, because unless you want that for yourself, you can't have it. You can't convince a family member, you can't convince a friend, you can't convince a loved one that this is the appropriate approach for them. They have to want it, they have to be on board. They have to be the one who's motivating themselves. You can't do it for them, because anything that's worthwhile is usually not that easy to do. And to achieve optimal health using an alternative approach that isn't easy to do, just take a pill, is not easy. If you have to change your lifestyle, if you have to change your diet, if you have to change the way you're doing things, that's not an easy approach. It's so easy to take a pill. That's why that's so successful in Western medicine, is you take a pill. That's why it's so successful in nutritional medicine. You take a supplement. It's very defined, it's very easy. You don't have to think about it. You just do it. But it's really not the best approach to getting to your best healthy place. You have to be an active participant, no matter what the condition. And that's what compounding pharmacy and integrative medicine has allowed me to do. It's allowed me to enable those active participants in achieving their optimal level of health. And if it's been 1,000, if it's been 100, if it's been 100,000 patients, then I'm having a good place. I'm in a good place on this earth, because it's been a heck of a good ride, and it's been a lot of fun, and it's been extremely rewarding. And the most rewarding aspect beyond helping other people is that I've been able to pass this on to my children, that they're healers, that they are able to help others. Whether it's my daughter, who's a physics teacher, who's teaching high school students to move on and do great things in this world, or it's my daughter who's a massage therapist and a healer, or my other daughter who's a teacher and teaching children about nature. They're all healing. They're all having an impact on other people. And that's a gift that I've gotten from them. And that's what I try to give others. One of the most difficult parts of being involved in healthcare is that you're taught in school to separate yourself from your patients. One of the things that being an independent pharmacist has enabled me to do is to come out from behind the counter and to press the flesh, not just with a handshake, but with a hug.
Yeah.
Or be able to hold someone's hands and look into their eyes and be able to communicate in that physical and emotional and very vibrant sense. And you asked me what was one of the most meaningful experiences, and it's both a combined thing, and it can take place over a long period of time, and also happens when you least expect it. Probably 12, 14 years ago, I was doing a lot of work with hospice, and the hospice nurse came to me and called me on the phone and said, we have a child who is only 8 years old, and he's terminally ill and in tremendous pain and tremendously doped up, highly medicated. And we want to know if there's something you can do from a compounding point of view that can improve his quality of life and allow him to be with his parents a little bit longer and to give them their child back for as brief a time as it might be. And I said, yes, I think there is something we can do. And they said, well, this is a very time-sensitive thing. I said, great, have the doctor call me. The doctor called me. I discussed with the physician the alternatives, the treatment approach. The doctor approved it immediately. Hospice took much longer to approve the payment, but I said, you know what, I don't care if I get paid on this or not. It's something that we're going to do. Within a matter of hours, we had prepared the medication, we had hand-delivered it to the home, and the patient had started taking it. They were able to decrease their medications, other medications, so they were able to be cognizant, and he was able to be with his parents. And he only lasted a few more days. But he did ultimately die. But we gave him back that cognition, that ability to look at his mother, look at his father, to see them, for them to see him, to see his essence, and to appreciate each other. And it took 6 months later that I received a phone call from the mother. I'd never met her. I'd never met the father, but she called to thank me. And she called to thank me for helping to give their little boy back to them for just a short period of time. But it was so moving. And I've told this story many, many times when I was in Washington, D.C., lobbying on behalf of compounding pharmacy to Congress people, to senators, to their offices, to their staff. And every time I tell the story, and this is over a decade later, I'm still moved by it. And I'm the one telling the story. So that was a very strong part of compounding, of how I was able to make a difference. I was using allopathic medicine, but I was able to use it in an alternative approach, a different dosage form. We were able to put it into a transdermal cream that went through the skin and was able to bring that child back. Recently, a woman came in and she had had terrible problem with agoraphobia, panic attacks, anxiety, inability to leave the house. And she started on low-dose naltrexone and had been using it for only a couple of weeks. but it was changing her life. She was able to go out. She was able to go to the grocery store, able to socialize, able to drive a car. And she drove here to our pharmacy 35 minutes from her home to get her renewal, to get her refill of her low-dose naltrexone. And I happen to have been there. I'm not here every day, but she asked if I was here. And I came up and I started talking to her. And she said, "This is the change you've made in my life." And I said, "Thank you so much. It's so nice to be able to hear that story, that we've changed your life, that we've had this impact on you. That's wonderful." She says, "I have to let you know, this is not the first time that you've affected our family." And as soon as she said that, I stopped. I'd never heard her. I'd heard her voice only 10 years before on the phone. I had never met her. I didn't know her name. And I said, "We've helped your family in the past?" She said, "Yes." I said, "Did you have a son who was in hospice?" And she said, "Yes." And right there, it was a cry fest. I came out in front of the counter. I had a first day student who was there, an intern who was here with the summer for us, working on a project, pharmacy student. And she saw her preceptor start crying there in the middle of the pharmacy and just holding on to this woman. And she and I must have hugged each other for 10 minutes. It was one of those things that just happened. Having that woman come into the pharmacy and express the impact we'd had on her life, on that of her husband's life, of her son, how we gave them a gift that they could never get otherwise. We gave them a gift that she said no one else could give them. That's what compounding has enabled me to do. To have it happen again a decade later, to once again give her her life back with low-dose naltrexone, with LDN, is again that gift that doesn't come from something that's just happenstance. That is a divinely inspired type of thing. It doesn't matter what divination, what divine creature or divine source or God you look towards. That's something that's a gift. And I don't have the skill to perform brain surgery. I don't have the skill to create beautiful art. But what I do have the ability to do is I have the ability to compound. I have the ability to use the knowledge and information that others have worked very, very diligently and to great extents to gather and to learn and to teach. And I have the ability to take that and put it into a mode that I can deliver to patients, to put that into a communication source that I can educate patients how to speak to their doctors, that I can talk to their doctors and help them understand how this very simple approach can be life-changing and hopefully put them at ease and eliminate some of their fear of looking at something different. Try to alleviate some of their fear of potentially doing harm because they don't know anything about this approach. There's something about taking in low-dose naltrexone, something about taking in an alternative or integrative approach towards treatment, towards health, that starts out very scary. Because it's different. But as you learn more and more about it, as you become more adept at it, you can make such great changes in people's lives. You can make such great changes in your own professional life. You can give yourself joy that you never even dreamed was a possibility. When I go to other conferences and other meetings where there's other allopathic traditional pharmacists there, and we're sitting and at a table and having dinner and having a conversation and saying, "Well, what do you do? What do you do?" And I tell them that I'm a compounding pharmacist, and they say, "Well, what did you do today?" And I talk about conversations with patients and consultations. I talk about conversations with physicians. I talk about educating. They sit there and they say, "I wish I was doing what you do. Boy, you've got a great life." And it hits me. I really do. I have that ability to work with other approaches that other practitioners don't have the time or the knowledge or the inclination to work with. I am never discouraged in my profession. I'm never discouraged at being a pharmacist. It is not a boring profession as that advisor in undergrad told me it would be. He was so wrong. And I am so happy that he was wrong. I'm so happy that I was inadvertently right. Because it wasn't out of any basic knowledge or wisdom that I had. It was because someone else helped me. And they helped me in a way that no one else had taken the time or had the ability to do. And that's what I try to do now.
Thank you so much for being such an inspiration and touching so many lives. In a way, do you view that illness that you had as a gift?
Absolutely. Absolutely. I have a condition called Tourette's syndrome. And Tourette's syndrome is a series of tics, either psychological, physical, or vocal, that are repetitive. It's almost like a sneeze or a cough that you can't suppress. And I've talked to other professionals. I've talked to surgeons, I've talked to professional basketball players, professional athletes, baseball players who had Tourette's syndrome. And without question, every single one of us takes that challenge and says it's made us a better person. It's enabled us to do what we do today better. Having that injury back when I was only 20 years old, it gave me a challenge. It changed my life. It stopped me from doing what I thought what my path was, but it changed my path. It didn't stop me from doing anything. What it did is, in reality, is it enabled me to do a wonderful thing and to change my profession and to be able to touch, as you said, possibly hundreds of thousands of patients, whether it was directly or indirectly, and I probably wouldn't have done otherwise. So, yes, it was a blessing to get injured. It was painful. I think about those days and I think about the agony I was in. I think about the intense discomfort. I think about the awful, awful situation my life had turned at. But on the other hand, what came out of that was so much greater than anything I ever could have done, professionally, otherwise. And I like to think that personally, it helped me see others and helped me relate to others so that I'm more enriched personally as well as professionally, that it made me a better person, that it made me more sensitive and more compassionate. I still have lots and lots of faults, but hopefully I'm on the right path to being a better person, and being a good person. And those challenges, I think, did that.
Yeah, I can see how compassionate you are and how much you care about your patients.
Thank you.
And how much you care about easing people's suffering. And like you said, a lot of clinicians, it's like they're almost separated from that. They're separated from their patients by the pharmacy counters. They're separated by, their desks or whatever it is. But you can actually step in and be there with your patients because you know what it's like to go through something that was scary and go through something that you thought was going to destroy your life.
I really did. I remember my father calling me when I was in intense pain, and I wasn't able to answer a phone. This was before there were cell phones, before there were mobile devices. And he came over to my apartment, and there I was cuddled up in a fetal position on the floor, and it had to have broken his heart. But that was the type of agony I was in, physical, and I wouldn't wish that on anyone. And perhaps I could have gotten to this point without that level of pain, without that level of discomfort. But everything has a reason. Everything has a purpose. And the Lord didn't make mistakes when He created us, so He must have been doing something right. And hopefully that has led to some positive aspects and some positive impacts on other patients and other people. But it certainly has given me a passion for what I do. Compassion, I think, is something that you learn in life. Passion is something that you're fortunate enough to benefit from, that you're fortunate enough to not have driven out of you. That when you have the opportunity to move forward, to learn, to treat, to help, that you can then reestablish that passion. I've been very blessed to have that opportunity. It's a wonderful, wonderful thing. And LDN is one of those tools that allows me to have a passion and maintain that passion for helping others.
Have you thought about what you would say to that pharmacist that started it all for you?
Boy, thank you, bless you. If that man was around, was still alive today, I don't know if he is or not, I want to take care of him, I want to hold him, I want to hug him, provided he allowed me into his personal space. I want to tell him what a difference he made in a young man's life, how he was helping to pay forward hundreds of thousands of patients, whether directly through me or through my students. I want to let him know how much he was cherished, what a valuable person he was, how important he was, not just to me, but to so many other people. And above all, I want to tell him that because of the impact he had on me, and on my life, that I truly loved him, even though I don't know his name, that he had really served a higher purpose. Now that sounds very arrogant to me to say that, because that makes, but irrespective of whether that's true, that I have had that impact on others, he had that impact on me, and that's how I feel. So I just want to say thank you. But that's so insufficient. So insufficient.
And what was the treatment that he recommended for you?
He helped me to stop the medication, to be focused, to meditate, to overcome the needs of the medication, to stop pain before it started. Basically, he allowed me to get rid of some of the straws that would have broken the camel's back. So he taught me about that there were natural alternatives for treating inflammation, natural alternatives for treating pain, that there were physical things that could be done, that there were things that I would do to decrease inflammation, things that I could do to improve my quality of life by making changes in my lifestyle, that then I didn't need the drugs, I didn't need the medications that were so debilitating. Getting through was not sufficient. He taught me techniques to thrive rather than merely survive. And that's what I've tried to explain and use for my patients over these last 30 or 40 years. With Graves' disease, we see changes in people's lives. We see the same types of responses as far as the long-term benefits that we see in so many other conditions. Hashimoto's, which is typically considered the other end of the spectrum, that low thyroid condition. Graves' disease, the very high or elevated thyroid condition. In both cases, the common ground is that it's an autoimmune dysfunction. Low-dose naltrexone, probiotics, vitamin D3, prebiotics, dietary changes, food sensitivities such as gluten, dairy, or other food sensitivities, modulating your lifestyle, and all of that has an effect on modulating the immune system so that it works back in that framework that's optimal instead of being completely out of proportion, disproportionate. So with Graves' disease, we're able to see patients become pregnant. We're able to see patients have their blood pressure come into normal ranges. We're able to see their cholesterol normalize. We're able to see their blood sugars normalize, no longer suffer from hypoglycemia. We're able to see patients have a better quality of life, full sleep. Their adrenals are no longer as totally taxed. So they no longer have chronic and constant fatigue. They have conditions that are other autoimmune conditions, which may be comorbid conditions, meaning more than one's going on at once, are ameliorated, they're improved. So a patient may have chronic fatigue syndrome or multiple sclerosis or fibromyalgia, and they may have a thyroid disorder such as Graves' disease, and these conditions have an impact on each other. A patient may have Graves' disease and have irritable bowel syndrome or inflammatory bowel disease or Crohn's disease. And many of these conditions tend to be ameliorated, come down into a place that they can handle. Restless leg syndrome, another condition that's modulated by low-dose naltrexone successfully, much more so than the conventional allopathic drugs that are out there, at a fraction of the price without the side effects. These all come into play. So we see these comorbid conditions that, whether it's Graves, restless leg syndrome, intestinal disorders, all of these things tend to be improved when they're modulating and appropriately getting to that point in your life condition associated with the immune system. And that's what the low-dose naltrexone seems to have, that benefit, seems to be able to bring those benefits to the patient. The vast majority of patients who come to us on their journey towards health, on their journey with these chronic diseases, tend not to be at the very beginning of that journey. Quite often they're using medications such as methimazole, which inhibit thyroid function, or they've been told that they have to have radioactive treatment, thyroid treatment, or they've been told they have to have a thyroidectomy, the removal of their thyroid gland. And that's very scary for a patient. So the patients who have come to us who've had methimazole, we're quite often able to see them, if the physicians are giving them low-dose naltrexone, decrease the dose that they're receiving, modify it, improve their quality of life. So by doing that, they're able to get rid of a lot of the side effects that can accompany the methimazole. For those who are going to have a thyroidectomy, that's a very good motivator for a patient to come to us for low-dose naltrexone, because that's a surgery. It scares the patient because it's going in through the throat. So it has both the physical aspect of being a surgery, of going under general anesthesia, plus the cosmetic aspect, which does have an impact on patients. And so they'll look for other alternatives. And of course, radiation is scary. Radiation therapy is scary. And so that will bring patients to us who want to use low-dose, who want to look at low-dose naltrexone as an alternative. We have seen patients who've been able to prevent thyroidectomy. We have seen patients who have not had to use thyroid radiation. We have seen patients who were postpartum, low thyroid function, who have come in and been able to use low-dose naltrexone, often in conjunction with iodine supplementation, conventional iodine, and have thyroid function restored without surgery, without being on longitudinal lifelong medication, without having to have radiation. So yes, we see these benefits, and we do have patients. The unfortunate thing is, so few of our patients come to us before they've had those very aggressive treatments. So few of our patients come to us at that point in their journey, at that early point where we can still have a definitive impact. So that is one of the challenges. There's no such thing as a treatment failure if you're able to help a patient. Even if you're able to modify things just a little bit. Remember, coming back to the quality of life, that's so important. In fact, to me, that's all important. I don't try to chase the numbers. I try to achieve the optimal health for our patients.
I understand that you're using LDN with canines. Is there a particular dose that you use?
Yes. We actually had to sort of back into the dosing. We took the dose for humans and taking an average weight of a human of 150 pounds, which no one weighs 150 pounds, but took an average weight of 150 pounds as the starting point, and then took the average dose of low-dose, the typical dose of low-dose naltrexone, and we divided that 4.5 milligrams per day by 150 pounds of person. And that gave us a range of 0.03 milligrams to 0.06 milligrams per pound for a dog. And that typically comes out to about 1 to 3 milligrams daily for most animals, for most dogs. And we have a maximum of that of 4.5 milligrams, just like we do with human beings. So the maximum dose that we give to a human, typically, for most autoimmune conditions or for cancer, is going to be 4.5 milligrams per day. With dogs, it's going to have that same top out level. So for a Malamute, or a very large animal, you're going to max out at 4.5 milligrams. But most dogs are between, say, 30 and 60 pounds. You're going to be anywhere from 1 to 2 milligrams.
I have a Pomeranian.
A Pomeranian. I would probably put your Pomeranian at about 0.5 milligram. You know, I'm guessing your Pomeranian only weighs about 5 or 6 pounds.
You know, he's kind of a giant Pomeranian. So
Oh, she's a 7-pounder. So, okay.
He's actually like 18 pounds. I know.
Can he move?
He's really fluffy.
Does he have a thyroid condition? You know, that's a very large Pomeranian. So I put him at between 0.5 and 1 milligram, somewhere in between there.
What are some of the benefits of LDN with people with cancer?
The benefits of LDN with people with cancer is that it seems to slow down or even reverse the progression of the tumor. We know that the patients who we've seen the clinical studies where they've had a tumor that was, say, a tumor in the tongue was the size of a walnut, that it reduced down to the size of a pea. Or in the patient who has breast cancer, that it is not going to eliminate the cancer, but it may cause the tumor to shrink dramatically. With a patient with metastatic cancer, it's going to slow down the progression of the metastases. In the case of dogs, my dog in particular, who had the inoperable lung cancer and metastatic cancer at the very beginning of his diagnosis, or when he was initially diagnosed, it decreased the progression, slowed down the progression of those metastases. It slowed down the progression of the metastases. We saw that he was not in pain because it was not infiltrating the bones at the same very aggressive rate that it would have otherwise. We saw that it shrunk the tumor that was in the lung, so it put less pressure on the lung, less pressure on the heart, as far as his ability to breathe, his ability for his heart to function. So we see this in humans as well, where the tumor will oftentimes decrease in size or simply slow down the progression. Now, as it's been explained to me by physicians who use LDN for cancer, is that the patient cannot simply use it and stop. They must use the low-dose naltrexone as long as they want to keep the cancer suppressed. So once again, it's not a cure. It improves the quality of life, it slows down the progression, and it makes it so that the patient may not need surgery, but it doesn't necessarily rule it out.
I know there were studies done in people with I believe women who were opiate addicts, and they were using naltrexone even at the full dose during pregnancy, and that was safe.
The Sinclair method for alcohol addiction. Dr. Sinclair was a physician in Sweden, and he projected or theorized that if you use naltrexone 1 hour prior to drinking at the full dose between 50 and 200 milligrams, and a single dose an hour before drinking alcohol, that it would decrease that compulsion for an alcoholic to get drunk or to go on a binge. So the person who is an alcoholic could potentially be a social drinker. Claudia Christian, the actress, speaks about this and has put together a documentary called One Little Pill. It's a 52 or 58 minute documentary. It's a wonderful little documentary. It shows wonderful graphics. It has testimonials and stories and her own personal story that she is an alcoholic. And Claudia Christian is a very brilliant fantasy genre actress who's incredibly bright. When I say brilliant, I mean she's a very smart girl, a smart cookie, and she can't be called a girl, she's an adult woman. And you're still very, very beautiful. And she was one of the first female powerful characters in fantasy and science TV shows. She was the captain in Babylon 5, and she does a lot of Comic-Con work and other things. But as I said, her life, she says, was destroyed from alcohol, and she's an alcoholic, and she would literally lost every million that she ever made due to alcohol. And until she came up upon the Sinclair method, where she takes the naltrexone 1 hour prior to having a drink, and then she's able to drink socially. And I've met with Claudia several times. She's spoken at several conferences that we both attended, and she's just an amazing person, an amazing woman. And she is very open and candid about how this has had this effect on her life. But she educates patients around the world, educates physicians around the world, and helps the quality of life, which is interesting because it's the same mission that I have, is to help patients' quality of life, and the same mission that Linda Elsgood, the editor of the LDM book, has, is to help the quality of life of patients through education of practitioners and individuals. So, free of any financial reimbursement, she has made this her life goal, her life mission, to teach patients the Sinclair method. And again, it's a very wonderful documentary. It's I think it's available for a nominal fee online. It's called One Little Pill. The author and director and producer is Claudia Christian, and she just does a wonderful job with this little piece of information.
Well, that's fabulous. It's amazing how many different things LDN can help, and naltrexone just in general can help. One thing I wanted to ask you about is fertility. So we know that women with thyroid disease can have a more difficult time becoming pregnant, staying pregnant, and they may have issues with postpartum thyroiditis. Have you seen any benefits in using LDN for purposes of fertility?
I have a very limited group of patients who've used LDN for fertility. I've had no patients who've directly used it with that result in mind, where they've gone through IVF or they've gone through other modalities for infertility. What I can tell you is that I've had several patients who have had Hashimoto's thyroiditis who were told they could not get pregnant. And by using LDN, their Hashimoto's thyroiditis came under control, and they ultimately did get pregnant. Concomitantly, I shouldn't say ultimately, concomitantly did get pregnant.
Amazing.
And, yes, so it's interesting because we've had the same effect with patients who had thyroid conditions and had gross obesity and infertility. So this becomes a question of which came first, the chicken or the egg. And because LDN has been used for compulsion and for compulsive aspects, and it's been used in conjunction with other diet approaches, weight loss approaches, we've seen it used successfully. Instead of an appetite suppressant such as an amphetamine, we've seen LDN used successfully to impede the compulsion eating and to work with these other diet programs. And we've seen patients who've lost weight and who've improved their thyroid condition and have been using low-dose naltrexone who have indeed gotten pregnant. So I don't think that it has an impact on release of the egg, on ovulation, but I think it may have an impact on inflammation and implantation in the uterus. So if indeed there is an egg and a sperm, and they unite, and we have fertilization, and there's subsequent implantation, then the reduction of inflammation, boy, I'm starting to sound like Jesse Jackson, can have a beneficial impact on pregnancy. So it's really hard to give you clinical evidence of a particular case where that was the goal in mind. However, I can talk about individual cases that I've had in my clinical practice where patients have seen this net result of being able to get pregnant where otherwise they were not.
Perfect. So LDN can help people with a variety of different types of compulsions and addictions.
Absolutely. Absolutely. There's a physician in Glenview, Dr. Andre Lev Weisberg, who's done a lot of work with low-dose naltrexone and compulsion associated with overeating and associated with weight loss. So he's had patients who were obese, who were very heavy, who had other health problems, and they were struggling with having that compulsion to eat and with being frustrated at not having weight loss that's going fast enough. So when they did a very aggressive weight loss program, and they still had compulsion eating or even boredom eating in the evening, he would have them using low-dose naltrexone to combat those compulsions, combat those urges to break their diet. And he had tremendous success. And we've seen it with other patients, with compulsions, with weight loss, where I've had patients who say, I can't survive this weight loss program unless I'm using phendimetrazine, unless I'm using some type of an amphetamine or a speeder. And I've had physicians who've come to me and say, you know what, my patients are only going to be successful on this if they're able to use, some type of an amphetamine. And I'll dispel them from that notion by saying, doctor, if indeed your patient has that compulsion where they feel they need that speeder, that amphetamine, please try low-dose naltrexone in lieu of that. Try that with your patients, use it in this capacity. It has very few side effects. It's not a controlled substance. There's virtually no drug interaction unless the patient is using a painkiller, and it's easy enough to ask them that question in advance. And we're able to have tremendous success with eliminating that compulsive eating that's associated with social stimuli, with social events that make you want to, eat and eat and eat. In fact, when a patient has anxiety associated with being in a social situation, low-dose naltrexone seems to help with that anxiety.
Wow.
It's not taking Valium. It's not taking, an alprazolam or Xanax or some other, or Ativan or one of those other benzodiazepines. Low-dose naltrexone seems to take that edge off. I don't know why. But we do have patients, though, who have been used for anxiety disorders. They've used low-dose naltrexone.
Now, is that at bedtime dosing, or is that before they go out and socialize? Because social anxiety is actually a common symptom of people with Hashimoto's too, and potentially Graves' disease.
Well, it's used on a maintenance basis. It's not used on an as-needed basis like with drinking with the Sinclair method, where you're using the high-dose naltrexone, the 50 to 200 milligrams. You're using anywhere from the 1.5 to 4.5 milligrams, the 4.5 milligram being the average dose, on a daily basis. So you're using it as a maintenance product. But for anxiety disorder, it seems to be quite beneficial.
Wow.
It seems to help with depression. It seems to help, but realize the one thing that all these have in common is inflammation. And low-dose naltrexone seems to lower those inflammatory markers, those inflammatory responses or results that people encounter. And that's why it seems to help with so many other conditions such as the gastrointestinal conditions, multiple sclerosis, chronic fatigue syndrome, fibromyalgia. The list goes on and on and on. Lupus is one that you wouldn't necessarily think that it would have an effect on. Rheumatoid arthritis is one that we've seen dramatic effects from low-dose naltrexone.
Wow, that's amazing. And a question for you about Hashimoto's. One of the things that I've seen in people with Hashimoto's is when they start on low-dose naltrexone is we'll often see that their symptoms improve and that their thyroid antibodies can dramatically reduce. So I've seen some patients within the ranges of 1,000 plus of thyroid antibodies going into the under 100 or sometimes even under 35 range.
Under 35 range being a very normal range in the general population. Yes, we do see that those inflammatory markers are reducing quite often. It doesn't happen overnight. It can take months before you see these markers drop down. What you'll see, though, long before the markers drop down is you'll see improved quality of life with your patient. And that's the big thing that you're looking for. The markers will come along. The labs will follow the physical results, but it may take some time.
When I first took LDN, I wasn't doing anything else. So I wasn't doing any nutrition, and I later found out that I had, a high yeast overgrowth within my gut. And I later learned that things like a yeast overgrowth can actually prevent LDN from working. Is there any truth to that, or are there?
Well, you're talking about inflammation, and when you're having an inflammatory condition, you then have barriers, and there's only so many insults that the human body can handle, or any body for that matter. So if you decrease the number of straws that are going into that basket, you're not as likely to break the camel's back. So I think that the human condition can be improved as we decrease the number of insults that it's subjected to. So if we have a dysbiosis, an imbalance in the intestinal tract of bacteria and other microorganisms, if we have yeast overgrowth, if we have food sensitivities, if we have a thyroid dysfunction, by addressing these one after another and correcting one after another, we then make the overall body stronger and more able to adapt to its environment that it's in. The human body is an amazing thing. The human body can handle so much, but the thing is, it can only handle so much. And once you've exceeded that so much, it's going to falter. Adrenal fatigue is one of the things that we see quite a bit, because the body is just trying to deal with all these insults, whether it's infection or surgery or physical trauma or PTSD or whatever you might come across. The human body can only handle so much, and then it says uncle. And once it says uncle, that's when you have to really step in and get more aggressive. And that's when we actually define disease. We define Cushing's disease. We define Addison's disease. When we have those very extreme positions, we define Hashimoto's and Graves' disease. We have those very extreme thyroid conditions at either end of the spectrum. We're not very good at working within 1 or 2 standard deviations of the norm. But once you get outside of the norm, we can say, aha, it's like shine a big bright light in front of me and then I can see it. But if you're just going to slowly dull it, then I'm not so good at noticing what's going on. There's a story about the frog putting him into a boiling kettle of water. And I tell this to my students periodically. If you drop a frog into a boiling kettle of water, he's going to see an immediate response. But if you have a frog swimming around in a pot of water and you gradually increase the heat, eventually he's going to perish. But along the way, he's not going to notice. Well, we're not very good at not noticing as things change slightly. But if it's very dramatic, we tend to see that and tend to recognize it. And unfortunately, that's the problem with medicine in general, is that we oftentimes miss those very subtle changes, those very subtle things. And it's not from lack of trying. A lot of times it's from lack of having time to focus. And if you have a physician who only has 8 or 13 minutes to work with a patient, it's very difficult to discover anything other than the very bright light.
What are some things that you wish people knew about LDN and working with it?
Great question. The first thing is you have to be your own advocate. You can't rely on your physician to do all the work. So that'd be number one. So learn about LDN, learn about how to communicate with your doctor. There's some wonderful resources online. The LDNresearchtrust.org, just LDNresearchtrust.org, is a wonderful resource for information about LDN. It's got videos, it has educational tools, and it's completely free. The LDN book, the appendix, I'm very self-serving because I wrote it, but I put the majority of this book is written for clinicians to understand low-dose naltrexone. The appendix, though, at the end, tells you how to talk to your doctor, tells you how to use the right words, the right terms, so that you're not going to put your doctor off. It tells you how to present the information. So it gives you that guideline, that outline of how to get your message across. I think that's invaluable because unless you're speaking the same language, you can't communicate. And then finally realize that low-dose naltrexone alone is not the whole story. Dietary changes, lifestyle changes are huge. So making those changes in how you're living your life, getting to bed at a decent time, discovering foods that are inflammatory to your body and avoiding them, using probiotics to stabilize your intestinal tract and prebiotics to complement the effects of probiotics. These are all very important things. So those lifestyle changes would be number 3. So become your own advocate, learn how to communicate, and then make the changes so that you're taking responsibility. There you go, 1, 2, 3.
Dr. Mandel, thank you so much for the work that you're doing.
You're welcome. This has been a pleasure, and I wish you tremendous success. I hope that those who view this will be able to take something out of it and improve their lives, because the bottom line is improving your quality of life.
Thank you so much for joining this episode of the Thyroid Pharmacist Healing Conversations podcast. I hope it's been incredibly healing on your journey. I know it was such a privilege and an honor for me to share this episode with you. It was such a pleasure to interview Dr. Mark Mandel, and I'm so glad I had the opportunity to interview him, and so grateful for his generosity and kindness and all of the work that he did for helping people with autoimmune disease and chronic illness to feel their best. If you enjoyed this episode, I hope you'll take the time to subscribe to my podcast. And if you get a chance, I would love if you could leave a review. That way, the podcast can be shared with more people. Of course, if there's somebody that you know could benefit from this information, please go ahead and share it with them. Last but not least, I did want to let you know that I am going to be streaming the entire Thyroid Secret documentary series between May 23rd and May 25th, and you can actually sign up to get notified for this. Where you have to go is thyroidpharmacist.com/TTS, and then you can be signed up for that. Thank you so much for joining the podcast today, and I hope that this has been a healing conversation for you.